Welcome, everyone. How are you? I'm Dr. Louise McCullough, chair of this year's International Stroke Conference. I'm also chair of neurology at UT Health Houston and Memorial Hermann Hospital. And today we're talking with Souvik Sen, who you just heard his talk from the Premiers study, which I find very fascinating. He is professor and chair at the University of South Carolina. Thank you for joining me today.
Thank you so much, Luis. As you heard my presentation already, I am a professor and chair in University of South Carolina, Columbia, right in the middle of the stroke belt. And we conducted the study out of both two states, South and North Carolina. And briefly, what we found was approximately 40% of stroke TIA patients actually have moderate to gum disease. And between those two treatment arms, intensive and standard treatment arm, there was a slight lower number of recurrent vascular events, stroke, MI, and death, 12% in the standard arm, 8% in the intensive treatment arm. Statistically not significant, but in the hypothesized direction. The interesting finding in the study was that the number of dental visits directly correlated with recurrent vascular event, lowest in the folks who came for dental visits 4 times in the year at least. And then the secondary outcome also had very interesting findings, including improvement in the risk factor profile, specifically statistically significant results in lowering of diastolic blood pressure over 12-month period, as well an increase in the HDL cholesterol level.
I mean, very, very interesting that you can get these kind of results in a relatively short time frame. So this is 1 year and you're reducing the number of vascular events. Again, as you note, the numbers were small, but in the right direction. And what I found very interesting was compared to historical control rates of over 20%, patients who were seeing their dentist had a significant reduction in those vascular events. So it really suggests that there's a benefit of the aggressive treatment, at least in the right direction, with us. But again, with the low end, but it really seems the biggest bang for our buck is getting people seen. And that seems to really maybe enhance their compliance. Or do you have any ideas how just a every 3 month visit to a dentist could make such a difference?
Absolutely. So, in terms of the dental care itself, the purpose was really to lower the level of infection, lower the inflammatory load, and we all know that inflammation does increase risk for atherosclerosis, atherosclerotic cardiovascular disease, and stroke. So, the first mechanism we can think of is that treatment of gum disease actually lowers the inflammatory burden. Of course, these patients came back every 3 months, and they also got some things which would be normally checked in a primary care, such as blood pressure check, medication compliance check, and we know all of those have direct impact in lowering the recurrent vascular event rate.
Fascinating. It really is fascinating. But I did notice also that there was a very slight uptick in sepsis. Again, very small numbers, so you can't say much yet. And there was a case of endocarditis in the intensive periodontal treatment. Is that a concern for you, or is that anything we should caution people about?
Absolutely. So the sepsis rate was the total number was 3 in the intensive arm and 2 in the standard arm. Pretty much goes along with what we notice in general stroke population. We were, however, concerned about that one infective endocarditis noted in the intensive treatment arm. At the outset, the study itself took a lot of precautions to avoid infective endocarditis by excluding patients who would need prophylactic antibiotic. An example would be somebody who has artificial valve or recent joint replacement. Making those exclusions, still there was this one case. Diving a little deeper into that case, the bacterial pathogen identified from the valve was something which was not present in the oral cavity.
I see.
So with that, we actually were able to safely exclude the possibility that the dental care in any way led to the infective endocarditis.
Great. Well, I'm sure you're planning larger studies with longer term follow up, but very impressive findings for a very 12 short follow up period of 12 months. So, very, very interesting, and we hope to see a larger study.
Thank you.